days.
Thanks, Jen. It is Tuesday, which means it's time to answer your medical question with our doctor on call. With us today, Dr. Tatyana Hamilton. She's a podiatrist with TriHealth, and our question today comes from Donna in Maineville. She wants to know if you can get neuropathy in your feet caused by type 2 diabetes to go away by doing things like losing weight and eating right.
So type 2 diabetes actually does cause some symptoms of neuropathy because of nerve damage.
Explain what neuropathy is for those who don't know.
Neuropathy occurs when the nerves that go down to your feet are damaged by high blood sugar.
So you can't feel your feet, they have the numbness, and then that cuts the circulation. That's where people could lose their feet.
Yes.
Yeah.
A lot of the symptoms that patients do end up feeling can range from numbness to tingling to burning sensations, and every single patient can have different sensations.
Does losing weight help?
It can help. What it can do is it can actually help.
Take your time. It's okay. We got all day.
It's okay. What losing weight can do is it can help lower blood sugar, and what that can do is let that patient actually get better glucose control, and that better glucose control can stop the nerves from getting damaged.
It's like one thing leads to another, but is there some degree of the pressure on your feet is less when you lose a few pounds? Does that play any role in that?
Not in terms of actual neuropathy, it does not, but losing weight does help with blood glucose control, and what it can also do is let patients become more active. And the more active you are, the healthier you will be.
When you tell people this, do you give them numbers? You know, it's kind of like telling the kid, this is why we've lost our teeth, you know. Do you go into more detail with patients now about this to really help them understand this glucose connection to weight and eating right?
Ideally, a patient should have a lower blood glucose, and an A1C is a number that we always hear kind of thrown around. Ideally, a patient should have a A1C of 7 or below for good glucose control. But I understand that that's not always a realistic number for patients. So what I do is I chat with them and I discuss that any lowering of that A1C or any lowering of that regular blood sugar that they take on a daily basis is a mile marker, and that's an achievement that is great for them and for their health.
Are things changing in the way you approach diabetics with these issues in the last 5 years or so?
I think now that we have so many different medications and modalities to treat patients, it has been a great help for them because there's so many options. Back in, 20, 30 years ago, we just had insulin. Now we have different types of insulin, different oral medications, and different treatments. And we're also incorporating exercise, weight management into treating those patients as well.
Yeah, it's more the fully rounded approach.
Yes.
So, all right, thank you very much, Dr. Tatyana Hamilton with TriHealth. Appreciate you coming in. Remember, the answers you hear from our TriHealth experts are just a good place to start. This is not a replacement for advice from your own doctor. Send us your medical question, if you will, and a TriHealth doctor might just answer it live on the air. Next Tuesday, just look for a link at wcpo.com/doc-on-call to submit that question. We'll answer one every Tuesday. All right.